Welcome, everyone. We are live here on Instagram, Facebook, and YouTube for the Chronic Courage podcast. And we are so excited to have you here with us today. Unfortunately, Amber cannot join us today. She is not feeling well. So we will go on and wish her a speedy recovery or a speedy feel just a little bit relief. That's important, right? We have to make sure that we are holding space for each other to feel that relief. Hi, Kimberly. How are you? Good evening, everyone. Good evening. Today we are going to be talking about insomnia and painsomnia. But of course, as usual, I have to go over the house rules. So let me do that while I'm here. Let me get all this stuff out. I want to make sure that I'm in both places, all three places, and I am. So let me get to the house rules. Okay. So, Chronic Courage is a platform dedicated to providing support, information, and empowerment for lupus warriors. While we strive to deliver accurate and helpful content, it's important to remember that the information shared on this podcast is not a substitute for professional and medical advice. Always consult with your healthcare provider for personalized guidance tailored to your individual needs and circumstances. Our discussions are intended to inspire and uplift, but should not be replaced. It should not replace the expertise of trained medical professionals. So stay courageous, stay informed, and always prioritize your health and well-being. Welcome, everybody. Welcome, everybody. As I stated earlier, uh, Amber is unable to be with us today, so I will be here by myself with you all. If you have any questions about the topic, we're going to be discussing insomnia and painsomnia, which are pretty much the same, but they do different things to the body, I guess. And I'm going to start with just finding out how many of us really have that issue. I know when I was on high doses of prednisone, insomnia was out of this world. I couldn't sleep to save my life. And when I wasn't sleeping, I was eating. And we'll just discuss a little bit about like what creates insomnia and things of that nature and how we can actually overcome it. So I'm going to share my screen so we can start the presentation. Y'all know me, I'm kind of prompt that 7:00 starts and then I'm ready to start, but I want you to get this information as well. So let me share my screen. Let's see, share screen. No. Let's get this back up. Hold on a minute, guys. Y'all know we've been doing this. I've been doing this for so long, and I still have issues trying to get things up and opening things up. I thought I had something up and I don't have it up. There it is. All right, we're getting it. We're getting it. We are getting it. We are getting it. Okay, let's go back here. Kimberly says, great topic. Insomnia is a thorn in her side. Absolutely, mine too sometimes. And she said she's been off prednisone since December 2023, but still having bouts. Yeah, it takes some time for prednisone to get out of your body. And it's really kind of crazy how long it takes for it to get out your body. So I completely understand you having some bouts of insomnia. So let's share this real quick. All right. So we are talking about insomnia. Let's try and show the slideshow from the beginning. All right, here we go. So we are talking about insomnia and painsomnia. And they're one and the same. One comes from certain things and the other comes from pain, basically, and how hard and difficult it is to get to sleep, stay asleep, and get good sleep while you have the issue of insomnia and painsomnia. So we all know, we've all been there. We've been wringing our hands. Um, we've been talking about. Can you all see this video? Because I'm looking on. Let me make sure that you guys can see it. Give me a minute, y'all. Can you all see that video? Hi, Bonnie. How are you? If you can see the video, give me a thumbs up. If you can see the presentation. Hi, everyone. Thank you for coming. Thank you for joining. We're talking about insomnia and painsomnia. So awesome. I'm glad you guys can see it. Let me get back to it then. So, we've all been there where we have tried to go to sleep, get some rest. We've been up just going crazy because we cannot get to sleep. We've got so much on our mind. Our bodies are hurting. We've got some things that are going on with our medications that might stop us from being able to get some rest. We might even be a little bit depressed, and not able to really get the rest that we need in order to get restful sleep. And then we've been to the point where we are really having a hard time simply because of the pain, where the pain wakes us up and it bothers our sleep, it bothers our body, and it's really hard to get some rest. And I think that's more of a commonality than we realize, that pain really wakes us up and really stops us from getting great sleep. And sometimes it's hard to say that you're going to get good sleep with lupus because depending on your medication, depending on what's going on with you, whether you're stressed out, whether you have some issues going on, whatever it can be hard really to get the rest that you need. So let's talk about it. The different types of insomnia. Let me try and get a different video for you guys because I see on Instagram, it is not showing the actual video. So I want to make sure that everyone is getting the information. So give me 1 minute. Okay. Thank you, Kimberly. Thank you, Bonnie, for telling me you can see it. Let me try and get this other one though. Slides. Let's see if we can do it. But let me talk while I'm looking for this new slide. It's really hard to get good sleep if you're not feeling well, if you are not having a good day, if you're stressed out. It's so many reasons why you can lose good sleep. So y'all, I'm trying to download the PDF so I can show you what I need to show you. And between medications, between stress, between everything that's going on with you as far as lupus is concerned, um, it's hard to get the good sleep. It's hard to get past the insomnia. It's hard to really understand what the heck is going on and how do you handle it. So, now that I got this, y'all, I'm doing 4 or 5 things at one time. Can you believe this? Um, we're gonna get these slides up so that you can see it. Let's see, downloads. We're getting there, y'all. We're getting there. We're getting there, y'all. Y'all gonna get this information. I'm gonna get this information to you because we all have to deal with this whole insomnia nonsense that really comes on. But as this is processing and uploading, it is really difficult to deal with lupus and insomnia. Like when I was on high doses of prednisone, not only was I eating everything in the world, but I could not sleep to save my life. Like it was difficult to even get to sleep. And then once I got to sleep, I was not able to stay asleep. Okay, now we getting it, y'all. Look at that. Look at that, y'all. Let's see how we go. Okay, so we left here, right? And we know that sometimes we are rocking ourselves to sleep. We are trying to just rock ourselves to feeling better beyond lupus. But insomnia can play a funky role. It really can. It can really stop you from having a good life beyond lupus. So there are 3 different types of insomnia: acute insomnia, chronic insomnia, and then you have, I can't read that from here, so let me go over here. Then you have transient insomnia. So acute insomnia is a short-term insomnia. It is brief. It occurs because of circumstances. You know, acute insomnia can go to be treated without any medications or any invasive methods. Then you have chronic insomnia, which is probably what most of us can deal with from time to time, and that happens at least 3 times per week and lasts at least 3 months. There are a number of at-home and professional treatment available for chronic insomnia. It may include medication, special therapies, and things like that to address the condition. And then there's transient insomnia. And maybe you all didn't know about how many different insomnias there was, but there are 3 insomnias. It's a short-term uh, insomnia, and it's lasting up to 3 months. And transient insomnia is usually temporary, and sleep will return to the normal state on its own. So you know how sometimes you can be stressed, and that insomnia comes on. It can be either acute, chronic, or transient. Hopefully, it's just transient. Once you get rid of that stress, get rid of the medication, then you're able to actually get some rest. I'm not going to say it's always going to be great rest, but we'll talk about that later. And then you have painsomnia. And we know what painsomnia is, right? Painsomnia is the inability to sleep due to pain. And that's it's really exactly what it is. Painsomnia can not only exasperate pain, but it can cause more symptoms like headaches, nausea from the lack of sleep. So important. So important. So let's talk about it. Someone on Instagram said that they didn't know that there were 3 different types of insomnia. There are 3 different types, and there will be 3 different types of ways that you can take care of it. Thank you all for tuning in. If I have not said that yet, I appreciate you all. I'm not going to be before you very long because Amber is ill and was not able to join us. So I'm trying to give you the information that we wanted to share with you. And in a not a quick fashion, but in a fashion that's easy to understand. So we talked about insomnia, we talked about painsomnia, we talked about what they are. Let's talk about what causes them. So we know electronics, that blue light before bed can cause the insomnia. Things that make you upset events, whether it be a death in your family, whether it be a change in medication, whether it be the dog pooped on the floor, upset events can really make that insomnia worse. Stress, I cannot stress it enough. Stress can be so horrible for your sleep patterns because you're worried. Of course, you're not going to sleep well if you're worried. Heavy meals before bed. You know how sometimes you say, "Oh, I done ate. Now I'm ready to go lay down." Can't do that. Number one, it can give you some um, how you call it, indigestion problems and digestion problems. And number two, it can interrupt your sleep. So just make a note of things that can make insomnia worse. And I'm talking insomnia because insomnia and painsomnia are pretty much the same thing. It's just that with painsomnia, you're actually tagging on that extra pain bit for it that makes it even worse. Medications, like I said, if you're on prednisone, it might disrupt your sleep. Certain medications don't give you the opportunity to sleep well beyond those things. Caffeine, nicotine, and alcohol. So I know some people might want to still smoke, and some people still want to drink, and drink the coffee and the alcohol. And I look, I always say do things in moderation and make sure that you're keeping a food journal so that you know how those things are affecting your body as you deal with lupus. So you want to limit caffeine, nicotine, or alcohol before bed and throughout the day. You don't want to be drinking 4 cups of coffee and think you're going to get a good night's rest. No, your body is all hyped up with that coffee, and it still has to have time to process through your body. So keeping a food journal will help you to keep track of how much caffeine you're having that day. One night you might have some bad insomnia and you need to know how much caffeine you had that day, or if you were smoking cigarettes or whatever the heck you smoke, you have to just be mindful of that. And then sedentary lifestyle. We are doing Walktober right now, and the purpose of Walktober is to really, really get you involved in moving your body, and not moving your body to a point where it hurts, but moving your body to a point where you feel better. So you can move your body too much and hurt yourself, but it's important for you to move your body throughout the day because it wears out your body and it gives you your body the opportunity to become tired so that you can rest. So insomnia can cause so many different things. And I want you, I'm really big. I'm a former educator. So I want you to be educated on your body and how things interact with your body and how it can harm you or help you. So if you look at what insomnia can do, and I'm sorry, y'all, I'm looking at this other thing because, I don't have on my glasses because then you'll see the ring light, whatever. So, the complications of insomnia can be wide and varied. So psychological, lower performance, slowed reaction time, risk of depression, risk of anxiety disorder. You ever notice when you're in a brain fog that you had not good sleep the night before? You ever notice that your your reaction time to things were kind of slow when you didn't get enough rest? Or the brain fog was even worse? The brain fog is going to come, don't get me wrong, but the brain fog was super worse that you went down the wrong side of the street. True story, true story. When I was first diagnosed, I was driving down the wrong side of the street and I thought I was in the right because number one, I was in a serious brain fog. But number two, I had realized, hindsight is 2020 when you look back, I wasn't getting any rest. I was on high doses of prednisone. I was like skied up on prednisone like I was a little crackhead or something like that. So, not getting enough rest and having those times where you are really dealing with a lot as you're going to bed can really create that insomnia and can create other issues for you. So you want to be mindful of how you're doing. And I'm continuously saying to be mindful of what you're doing, because even though what we have done has not created lupus, What we do will make it better or make it worse. So when I say be mindful, I want you to be educated. I want you to understand your body. I want you to do the things that give you the opportunity to understand your body. And I want you to do things that help you more than it hurts you. That's what I mean by being mindful. I don't mean that you have to sit around and do meditations 24/7. No, I'm just saying that in order to beat lupus or defeat lupus every single day, you have to find those coping skills. And in order to find those coping skills, you got to know your body. And when you know your body, you can do things to help it more than to hurt it. So, other complications of insomnia: heart, risk of high blood pressure, risk of heart disease. Some of us might have some issues with high blood pressure or heart disease. It might not be because of insomnia, but this is just something that insomnia can, really hurt you with. Muscular aches and weakness, your lymph nodes, poor immune system function, your pancreas, risk of diabetes. And, I was diagnosed with type 2 diabetes maybe in 2018 or something like that. I don't keep track of the dates that I was diagnosed. I just know I was diagnosed. So I was diagnosed with diabetes when I was just weaning off prednisone. And just to tell you a little bit about prednisone, prednisone takes a long time to wean your body off in a healthy way that it doesn't hurt you. It takes so long to wean your body off. And I was a vegetarian, a vegan. I did all that, and I still got type 2 diabetes from, the use of prednisone, and besides the fact that diabetes runs in my family. So it's really it's really important to learn your body. And I see Sugar Plum said um, she's still learning her body. Absolutely. I think we're always going to be learning our body. I think it's important, though, if you have not started doing this, to begin to keep a journal of everything. And I know it's daunting, it's annoying, it's a nuisance sometimes. But if you're keeping track of your symptoms, if you're keeping track of your food, if you're keeping track of your mood, you are constantly learning how your body operates with lupus in it. And you are constantly seeing how you can change stuff to make it just a little less with a flair. Now, if you keep all these mood journals and all the journals that I'm telling you, it's not going to cure lupus, but it's definitely going to put you in touch more with your body and what works for you, because what works for me might not work for you. So you have to make sure that you're keeping track of what's going on in your body so you know what to do. A lot of times we try to do a sweeping thing of, you know, I did this, so you should do that. No, we have to know our body in order to understand what we need to do to help it more than to hurt it. So I appreciate your comment. If you have any questions, go ahead and put them in the chat box. I will try and answer them because I'm looking at Instagram and uh, Facebook and YouTube. So how can we fight insomnia? How can we do it? We talked about what creates it. So how can we fight insomnia day to day? Like I stated, eliminate stimulants that create insomnia. You know, the alcohol, nicotine, caffeine, and all of these things are difficult to stop if you've been doing them in abundance. But like I said earlier, everything in moderation should work for you. But make sure that you are not over caffeinating, over drinking. If you're smoking cigarettes, please, that will cause you a flare instantly. I know you might feel like it doesn't cause you a flare, but it really does cause flares. So you got to be careful with the nicotine. Try and get some help to eliminate these things and make sure that you're balancing it out. Exercise regularly. Y'all, I cannot focus on this enough because look, I'm a former athlete, been to two different um, Olympic trials, And what I know is that when I move, those endorphins that are created in my body help me to feel better. It's like my own personal high. It releases those that stress that I have. It releases every all the cortisol that comes with stress. It really does help day to day. And I'm not saying that you have to do huge workouts. That's why we do Walktober. That's why we do Fit Friday. That's why we do these little things that can help you just feel just a little bit better day to day. And I know I said that everybody is different, but one thing, a couple of things that are really universal to every single lupus warrior is you have to move, you have to watch what you're eating, and you have to take care of your mental health. Those are three universal things that we must do, not even because we have lupus, but in life in general. That's the only way that you're going to defeat lupus day to day without stressing yourself out all the doggone time. Now, Sugar Plum said that she was on 25 milligrams of prednisone going on 2 weeks now because of a flare I'm in. But my rheumatologist said I need it right now. Yeah, you know what, Sugar Plum? Look, the bad thing is that sometimes we will need it. I just had to have a round of prednisone as well because I had hives, and I have hive. I just went outside for like 5 minutes to go to the store today, and the hives are back. So sometimes we're gonna have to do that, but once we are off it, we can start to do the things that are right for us and begin to learn our body well enough so that we know what to do to make sure that the insomnia goes away or that it lessens some. Because sometimes, you know what, the insomnia is not going to go away. Sometimes it's going to just linger for a little bit and we have to work around it, whether it be taking naps during the day or finding different ways like we're discussing right now. Oh, thank you, Kimberly. Yes. Look, we do Walktober for movement. We do a lot of different movement um, challenges. And Kimberly is my Walktober buddy, man. I'm telling you, she walks every single day. And it's not anything that stresses her out. It's something that she does every single day. Every movement counts. We always say it. Every movement counts. And it counts towards your health. So exercise regularly. Reduce your stress. Now I don't know how you're going to reduce your stress, but the reality is some people you just got to leave out your life. Some things just have to be left alone, and you can't worry about hurting their feelings because you have to do it to help you. So you really have to learn how to find that stressor and remove that stressor from your life and from your body, from your mind, from your soul. Magnolia on Instagram says prednisone first thing in the morning and don't take after 12 p.m. helps her. That's a good little tip. Thank you, Magnolia. I appreciate that. So reducing your stress. Okay. How can we fight insomnia? Do not eat or drink right before going to bed. They say everything should be consumed by 8 p.m. Now I'm not gonna lie to you. I don't do this often. Sometimes, I try to finish my meals by 8. But if I'm running around or if I'm doing an activity like this, I had dinner, but I have not had like, my little snack or whatever have you, things that we have habits of doing, you might not finish by 8. But then make sure that you're not going to bed right after you eat because like I said, it's not good for your digestion. And it really can give you some acid reflux and things of that nature. So make sure you're not eating right before bed. Limit activities in the bed. Do not balance the checkbook. Don't study or make phone calls. Avoid watching TV or listening to the radio. Look, those are all stimulants. Those are all things that's going to make you think. It's going to make your brain continue to go moving, moving, moving. So you want to make sure that you're limiting that. Some people don't even have a TV in their bedroom. Look, if you reduce your screen time, it really makes a difference, whether it be your phone, the TV, or phone calls or whatever have you. But you have to make sure that you are not doing these things right before bed because those things are going to stimulate you to think. You watch. Some people watch the news, and look, there's a lot going on in the world. The news can be so daunting, and it can be very hard on your brain and just trying to get to sleep after watching something like that could be really difficult. Magnolia on Instagram says reduce screen time for 1 hour before bed. Sometimes I say even more than that because you have to process it all out. Sometimes I tell you all that if you do brain dumps, that can help. But like my son doesn't have a TV in his bedroom. He doesn't live with me anymore. I'm an empty nester, but at his house, he does not have a TV in his room. He goes in the room and he uses it for sleep. And that's important. That goes right to the next point. Make your sleeping environment comfortable with a good temperature, lighting, and noise. It should be controlled to make the bedroom conducive and inviting. You want to make sure that you are going to have a great night's sleep in a place where you're comfortable. So make sure that you're doing the little things that help you get the rest that you need. Kimberly, have fun at your church meeting. I will see you on Saturday. Thank you for coming, darling. I appreciate you. Um, Boney says she's also still learning her body. She's on 45 milligrams of prednisone and sleep is non existent. Yes, on that high prednisone, I imagine that sleep can really forsake you for some time. Talk to your doctor though about getting around that and what you can do to possibly get at least an hour or two per night. But when you're on high doses of prednisone, I'm going to tell y'all it's so difficult. It's so difficult to get the sleep that you need and the sleep that you really, really need because you need to be well. When you're sleeping, your body is regenerating. Your body is, refreshing. There's so many different things that happens when you're sleeping. So it's important to talk to your doctor and work out a plan. Work out a plan as to how you can um, learn how to break this insomnia chain. These are just small little things that I have given you to help you to get past those issues, maybe help you get 2 hours of sleep. I'm not going to say that the information that I shared with you will completely get you to sleep 8 hours a night, but it will help to get you some type of rest beyond insomnia. And you know what? When we're worried about stuff, well, we might be worried about lupus itself. We might be worried about going to the doctor. We might be worried about just dealing with everything that we're dealing with from day to day, and that can create such a worry in us that we are not able to rest comfortably. But if you're doing certain things, if you're minimizing those stimulants like caffeine, alcohol, if you're minimizing your screen time, if you're minimizing your stress, and like I said, it's not like you could just say, "Oh, I'm going to turn off the stress right here." Sometimes you can. There are little things that you can do to limit your stress as well. You can do things like meditation. I know y'all don't like meditation. Some people like it, some people don't, but meditation takes 2 minutes. Like we did earlier today, we did a walking meditation where you're breathing. You know how your parents used to tell you, darling, take a deep breath. It really makes a difference. It is really something that calms you down. So limiting your stresses, maybe taking some deep breaths, maybe doing some meditation. I know this sounds so cliche. Maybe do some yoga. It does sound cliche, but these are things that are known to work for many people. And if it doesn't work for you, then try something different. Try it a different way. But don't just try it one time and then say it doesn't work. You got to try it consistent. You got to be consistent with it. And that's what coping with lupus is about. It's just being consistent with tracking your symptoms and finding out what food does to you and how you should be eating. Sometimes even if you find out what your blood type is, to find the way you should eat with your blood type, that is real. Those are real things that you can do to get the results that you're looking for. So make sure that you're just limiting those stimulants, making sure that your bedroom is comfortable, making sure, they say if your bedroom is cooler, you'll sleep better. And we do a little sleep challenge. I forget when I do it usually. I think we usually do it in November actually, where we have a sleep challenge and we give you different ideas and different ways to try and get the rest that you need. Now, sometimes you are going to need some help. You might need, a medication, or you might need some therapy. You might even need some acupuncture or something like that to help you get the rest that you need. It's up to you to find what works for you. And if you're keeping those journals, you're able to find what works for you and what doesn't work for you. And then you can go back to the doctor and say, look, I tried this, I tried that. I need your help more because the things that you told me didn't work. I tried it for 28 days. I tried it for 30 days, and I'm still having issues resting. Someone had told me before that B12 helps you rest. I've never dealt with that, so I wouldn't know. Other people say that if you use CBD, that helps you rest as well. I guess you have to find what's right for you. I can't knock anybody from taking Ambien or using CBD oil or using CBD or smoking marijuana or whatever have you. That's your choice. Whatever works for your body. There's not one way to fight it, but find the way that works for you and use that way to make sure that you are getting the rest that you need. Because when you don't rest, then your body is haywire. You're not giving it an opportunity to um, refresh and regenerate not only just your body but your mind. That rest need your mind needs that rest, and we know there's several types of rest. Just like there's three types of insomnia, there are several types of rest that you need, and that rest is very important as far as sleep is concerned. So I hope that some of the information was helpful. If you have any questions, I'll be happy to answer them, whether they're about lupus or something else besides insomnia. But it's real important for us to just begin to take the time to learn what works for our body. And sometimes, like I stated, it's just a matter of writing it down every single day. There are even apps that you can use. You have Isla Health, you have View Health, you have Guava. These are three different apps that you can use to help you to take care, find your symptoms, what's going on every single day, to write down what you're eating and seeing how it's helping you or hurting you. And to make you understand, oh, okay, today I ate kale and I noticed that my hands swelled up. Maybe I'm allergic to kale. Maybe kale just doesn't work for me. Tomorrow, I'm going to try and eliminate it and see what happens and go from there. So it's important for us to really begin to be more action oriented for ourselves, more on top of what we're supposed to do for us, so that the doctor will work better for us. Someone on Instagram, RS Culver, I'm sorry, the lights are starting to bother me, y'all. Using arthritis strength Tylenol for pain that is from arthritis or pinched nerve seems to be helping me sleep the last few days. Oh, really? I don't know. Arthritis Tylenol never did anything for me, but I have a high pain tolerance and I have a high drug resistance tolerance. That's why I'm glad that I don't use illicit drugs because I'd probably be strung out. But if that works for you, awesome. That works. I used to be on Ambien that used to keep me up. It's really just finding out what works for you and what helps you. With certain pains, though, I know I get those Charlie horses. I don't know, Charlie horses or the pain in your legs at night. And what I had to do when I was getting those, I literally just took a spoonful of um, mustard because of the turmeric. It actually quelled those Charlie horses and quelled the pain that I had. Ah, see, yeah, chocolate diamond. I was thinking the same thing that it might be PM arthritis Tylenol. Um, but I just took large scoops of mustard, and that helped. The turmeric in it actually helped me. So you start to find different things that help you throughout your lupus journey. And just remember that something that helped you yesterday might not help you today. So you might have to switch up and change up what you're doing so that you can get the rest that you need. Now, when you have that pain, sometimes you might need pain medication, other times you might not. You might be able to do deep breathing, you might be able to do meditation. But this, I know sometimes the pain is just so unbearable and it's so hard to get the rest that you need. And you got to talk to your doctor about how to handle that and what you can use. The unfortunate part is that lately, lately it's been a struggle for a lot of lupus warriors to get pain medications. And it seems like people think that we're seeking just, pain medications just for the fun of it. So I think that it's important for you to have a great conversation with your doctor as to when you get these pains that are unbearable, how can we handle this? How are we going to handle this? And you have to have that conversation with your doctor, because when you don't want to have it when you're having the pain, you don't want to have it when something's going on. You want to have that conversation when you're feeling well so that you can ask that doctor, what are we going to do if I have an episode with lupus where I'm having these flares that are keeping me up at night? What are we going to do? What can we use to help me feel just a little bit better and get rid of that pain so I can get the rest? I think once you have those conversations with your doctor, then you're able to make a specific treatment plan for you. And that helps in the long run to know exactly what you're going to do and not to have to worry about someone thinking that you're just wanting pain medications just for the heck of it. R.S. Culver said, people have suggested to me to take Benadryl to help with sleep, but it keeps me awake. Yeah, Benadryl doesn't help me either. I don't know if anybody else has that issue, but I, I I do Benadryl only when I have the hives and things like that. But Benadryl, I don't know, like I think I just have a high tolerance for pain and I have a high tolerance for drugs or whatever have you. Boney said, Sugar Plum says, Boney, aching to help myself. I take prednisone in the morning and a few hours before bed. So when the night comes, I get at least 6 hours sleep. My pain is something else. I bet it is. I bet it is. It is so hard to deal with the pain of lupus. It really is. Adding turmeric to help with pain now. Yep. I'm gonna tell you, just make sure, if the only thing with the turmeric, to make sure that you're not on blood thinners because it will make it worse. So just check with your doctor. But the turmeric, look, turmeric helps. I shared something I don't know how long ago it was. I shared a turmeric tea. I'll share it again this week. You can do turmeric teas. You can do, like I said, I do mustard sometimes. Like if I want to walk a lot, like I'm walking a lot this month because we're in Walktober. Um, I definitely take a scoop of mustard just to cut it off the path. You want to make sure that you're still going to stay healthy as you're doing everything for yourself. So I hope that this discussion was good for you all. I hope you learned something. If you have any further questions, feel free to reach out and chat with me via instant message or even on this, on the comments here later on. But that's insomnia and painsomnia, which is so difficult to deal with. But hopefully, I've given you some tips that will help you to begin your journey to a better and more restful night. So, thank you so much for tuning in, everybody on Facebook, YouTube, and Instagram. I appreciate you all, and hopefully, this will help you. If you didn't get the information, right now, just play it back. It'll be on all the social medias as well as our webpage. So I appreciate you all tuning in. I hope that tonight you take some time to, number one, do a brain dump so that you can get all of that stuff out of your head and you can remove some of that stress that came through in your day. Number two, I hope that you take some deep breaths so that you can clear your mind and your body from any type of issues that you feel any type of pain and everything that you feel. And number three, I hope that you're able to go in your bedroom and feel like it's a sanctuary for you to just stop everything and to rest as well as you can. And if you wake up in the middle of the night, just literally continue to lay in your bed and just do this type of breathing. You're going to breathe in for 4, you're going to hold for 7, and then you're going to blow out of your mouth for 8. It's called 4-7-8 breathing, and it really does help you to calm your mind, calm your body, and help you get the rest that you need. So breathe in for 4, hold for 7, blow out for 8. Do that a couple of times, and I hope that your body begins to respond to that. Now, don't just do it one time and say it didn't work. Try it a couple of times. Keep doing it every night. I know we want things overnight. We want things to stop. We want the pain to be finished, but we didn't get this stuff overnight. So we have to be patient with ourselves, be patient with our body. It's still sustaining us through this lupus journey. So make sure that you are trying to do everything that you can do to get the rest that you need so that you can, minimize those flares and hopefully get more rest than you ever had. All right. So thank you everybody for tuning in. Um, I hope that you enjoyed this live. And if you want to reach back out, go ahead and do that. And I'll be happy to answer any questions. And look, I don't know all the answers, but I will find the answer for you. All right, guys. So I will talk to you guys soon. And thank you for tuning in. I hope you guys are walking with us for Walktober. If you're not, look on our page. Come on and walk with us. It's very doable. And it's something that will help you in the long run. So have a great night, and I'll talk to you later. Bye.